Assalamu alaikum everyone, welcome back to my channel and happy weekends to you all. Our today's topic is hyperprolactinemia or high prolactin. First of all, what is hyperprolactinemia? Hyperprolactinemia is a condition in which there is high prolactin in the blood. What is prolactin? A prolactin is among the reproductive hormones that play an important role or that helps in the production of breast milk. And it also plays an important role during reproduction. This prolactin is present in both male and female. But in male, this hormone is supposed to be in a very small amount. As I said yesterday in our previous topic, that androgen is supposed to be in a very small amount in female. So this prolactin is supposed to be in a very small amount in male. If there is high prolactin in male, it leads to some abnormalities in male. And this leads to a man to present with some female features like breast enlargement and other symptoms. This hyperprolactinemia, it interferes with the production of follicle stimulating hormone. This follicle stimulating hormone is also a hormone. This hormone helps and then it acts on the Graafian follicles. And then when it acts on the Graafian follicle, this helps the Graafian follicle to produce an egg. This causes ovulation. So if there is hyperprolactinemia, follicle stimulating hormone will not be produced, or it will be produced but in a very low amount, and this causes absence of ovulation, and this leads to infertility. Now, what are the signs of this hyperprolactinemia? There are several symptoms of this hyperprolactinemia or high prolactin. We have some menstrual irregularities like absence of menstruation, scanty menstruation, spotting in between periods. We have hot flashes. We have discharge from the breast milk, like breast milk coming from the breast. And that woman is not pregnant or is not even breastfeeding. And then we have decreased libido, vaginal dryness, and so many symptoms. In male, this hyperprolactinemia, it leads to some features or abnormalities like breast enlargement, as I mentioned before. There is discharge from the breast, and then pain also, and then gynecomastia. All these are symptoms of this hyperprolactinemia. What are the diagnoses? How to diagnose this hyperprolactinemia? This hyperprolactinemia needs a proper diagnosis, need a confirmatory diagnosis. So, if you happen to experience one or more of these symptoms, kindly go to your hospital. This one, the gynecologist or the doctor will recommend an investigation, which is mostly a blood test. The doctor will check the result and see the level of your prolactin. The doctor will see if your prolactin is within normal range, is it high or is it lower than normal. All this doctor will see after this investigation done. Now, prevention and management. After you visit your doctor or gynecologist, after this investigation was done and already confirmed that you have this hyperprolactinemia, the doctor will recommend some medications or injections. After that, he will give so many advice. These advices include, he will advise you, if you are already taking alcohol, you stop taking this alcohol. And then if you are smoking, you have to avoid this smoking. You have to avoid taking any tobaccos. You have to take proteinous food. You have to avoid sugary food. And then there are some food that decrease the amount of prolactin, like shellfish, like this spinach, like vitamin B6, and other food. So if you happen to see or to experience any of the symptoms I mentioned before, kindly visit your doctor or consult your doctor for a proper diagnosis, investigation, and management. Thank you.